Cassandra Winzar is the Chief Economist with the Committee for Economic Development in Australia, and that today launched a landmark report titled Duty of Care, Aged Care Sector Running on Empty. And she joins me now from Perth. Cassandra, many thanks for your time. I do note from an earlier report by KPMG that said in 2020 there were 335,000 people in residential aged care, another 840,000 accessing the Commonwealth Home Support Program. But no matter whether people are at home or in care, workers for all of those people are required.
Yeah, so we absolutely need a huge amount of workers to care for our older Australians. And this challenge is going to only get worse because we have an ageing demographic and there's going to be more Australians that are requiring care services, whether that's all at home or in residential facilities. And if we're having challenges now, we really need to start taking some action so that we'll be able to provide the quality of care that the community expects for older Australians, for themselves, for their family and their loved ones.
But you're saying there could be a shortfall of 110,000 workers by 2030. Now, that really raises questions for anybody watching this who might be beyond the age of 65, raises real questions for who will care for them if their health deteriorates in their later years.
Yes, so we really need to take action now, or we won't be able to provide the amount of care that Australians will need. And we're already having challenges at the moment. And what we found in our report is that there's quite a large percentage, over 14%, of aged care beds that are currently sitting empty because of workforce shortages. So there's demand, there's waiting lists for these services, but they're not able to be provided because they don't have the workers to staff the facilities. And that's particularly challenging in regional areas. And what we've heard from the sector is that in regional areas, some homes are operating at as little as 50% capacity because they can't staff their facilities.
Hang on, I just want people to really be very clear watching this so that they understand what's going on. In other words, there are waiting lists from older Australians waiting to get into some form of aged care. There are beds available, but because of the shortage of workers, they cannot use those empty and spare beds or bedrooms, whatever they might be, because they can't be cared for.
Exactly. So it's a huge problem. And when we've been talking to providers and those in the industry, they don't see it getting any better anytime soon. So it's really hard to attract workers to the sector. It's really hard to retain them. And demand is just keeping on growing and growing. So we need action from the government in order to expand the aged care workforce so that we can provide these services. Or what we're seeing is that older Australians are not getting the care they need. That might mean they're stuck at home and not getting a higher level of care, or it often also means they're stuck in hospitals. And that's not a nice place to be if you don't need to be there. It's not good for quality of life, and it's really expensive to fund as well.
Okay, with aged care, we know there are for-profit facilities and there are not-for-profit facilities. When you did this assessment, was there any difference, any noticeable difference in the number of spare beds, the lack of workers, as to whether it was a for-profit operation or a not-for-profit operation?
No, there's not a lot of difference. And when we look across the industry, all providers are struggling. We know that many of them are not financially sustainable. So over 50% of aged care providers are not making a profit, even if they are a for-profit provider. And there's not a huge difference in worker outcomes or financial outcomes between the not-for-profit and the private sector, because the challenges are so big and they're really facing, everyone is having to face those challenges. It's a huge issue and we do need more support from government if we're going to be able to provide care to older Australians.
Okay, does it raise real questions about the financial model? Because if you really haven't got the economic viability to keep a bed open, does that also then start to raise questions about the level of care and the standard of care that people are receiving when they do have a bed? Because I'm just saying that if they're having to cut costs by not taking people in because they can't get the workers, does that mean that there's also potentially even pressure on the type of care they can provide the people who are in there in the first place?
There's absolutely a lot of pressure on providers at the moment. As I said, many of them are operating at a loss. A lot of them are subsidising aged care through other areas of their business, and they're really committed to providing quality of care despite the challenges. But that can't go on forever, and the financial sustainability of the sector is going to fall over at some point if we don't make some changes. So we need new funding, we need new funding models, and we do probably also need more personal contributions to care costs from those Australians that can afford it.
Okay, so then you go back to the in-home care, because a lot of Australians hearing this will say, okay, that makes me determined that I will stay at home and I'll get services brought in. But even then, providing those services means you've still got to find the workers. So you've still got to be able to cope with the needs of those people who decide that they will remain in their own homes.
Yeah, so many Australians prefer to stay in their own home. And we're seeing this as a bigger proportion going forward as well. So the preference is to stay in your own home as long as you can, but that requires workers that we don't have as well. So that's a big challenge. So we need to be able to get the workers to fill the home care workforce. But we still will have growing demand for residential aged care because of the ageing population, and people with more complex needs are better looked after in residential care. So there's going to be growing demand both for residential and for home care. And that's where this huge shortfall of 110,000 workers comes from. It's looking at both those areas. So we really need to get the staffing problems under control, no matter which aged care service you're looking to access.
Just one final one, and there's also a problem of those people who are at home being cared for. If they do suddenly deteriorate, they might need themselves to be in care very, very quickly, which means there needs to be almost some ability, some threshold to be able to take new residents in who suddenly need to have that care.
Yeah, so there needs to be a bit of excess capacity in the system to be able to get people in quickly, and we don't see that at the moment. And what happens is they end up in hospital instead.
Cassandra, Winzar, many thanks for your time today and with that new report.
Thanks for having me.